usually whenever we're asked these kind of questions, to me, I think we always should start with like a needs assessment. So really define that specific need or pain point. So what is our biggest challenges you're facing with your current authorization process? Where do you experience the most delays or most denials? Are there specific specialties or payers that are causing the most problems? Then I think you should always look into your current cost. I think a lot of times we're always just trying to look for the future solution, but sometimes we really have to understand what our current state really is. And then determine our outcomes. So what are we hoping to achieve with this new technology? Are we trying to just reduce administrative burden? Are we trying to speed up the turnaround time? Are we trying to improve our authorization rates? Are we trying to increase revenue, decrease denials? I think one thing that we try to do here a lot is make sure that we involve all key stakeholders. So gather the input from your physicians, from your nurses, from your billing staff, from other relevant stakeholders into what their issues are. So that way we're not just taking it from a revenue cycle perspective, but we're taking it from a holistic system perspective. And then do some research on your vendors, talk to colleagues, talk to other people across the country, create a potential list of vendors, do some research on it on your own, understand what systems you're in. So maybe somebody really interacts great with Epic, but maybe they're not so great with, Sorian or AthenaIDX or other systems that are out there that may be part of your footprint. We always ask for, we do RFPs here, so we're a very formal process, but we always ask for demos and presentations. And one of the biggest things that I do is I always try to make sure that I bring the subject matter experts in, because I have found that a lot of times vendors say yes or promise things that they cannot deliver. So if the payer can't do it, how's the vendor going to go find it for you? So if the payer is not telling you that this authorization is for an inpatient stay or is for the ASC or is for these specific CPT codes, and the vendor's telling you like, oh yeah, we can do that, you have to really know what you're asking them to do and be able to call their poor responses, or what I would say their BS responses, out to say like, but explain to me how you're going to do that, because today I can't even do that manually. So, what's the magic behind your source? And then always check for references, call your colleagues, talk to people. And sometimes, I always ask them for references, but then I also try to reach in and say, who do I know that possibly uses this? Because I like the backdoor references more than the formal ones, because generally those really have good relationships, and you usually will find, just high praises and things like that in there. And then when the vendors actually come in, what are those integration questions? What's the functionality questions? What are the usability? So how can you make sure that it's really going to fix what you're trying to solve? And then, of course, cost and ROI, security and compliance, scalability and flexibility. So a lot of times we do stuff in small pilots here, but will it work across the board? We see a lot of people doing space in the radiology space, but they're not doing stuff in surgical spaces. So how do you fill all of those voids? And then implementation and support. So like what happens, how do you implement? What's your ongoing support? Not only from an initial point of view, but from an ongoing cost. And then if there's changes that happen, we know this space is constantly being reconfigured and constantly getting, stuff put in and out of the authorization space. So how quickly can they scale up and make those changes for you? Payer coverages, how many payers do they actually provide coverage for? And is it back to the list that you created? Is our biggest pain points, with payer A, B, and C, and is this product or is this vendor going to help us in those spaces? And then any kind of future development, is there somebody that's willing to partner with you? A lot of times we have great ideas, is there somebody that's willing to, sit down and really kind of plan out and invest in improving their technology where almost all of their clients can benefit? And then negotiations and contracts and implementation, and then support, so those are the things that come top of mind to me.